This is my oxygen tank. I can tell that it is oxygen because it is in a white bottle with a black cap and is usually labelled. This is my regulator. Inside my regulator is a Bodox seal. I'm just going to put this on and make sure that the seal is in good condition. And this, for the sake of this video, this oxygen tank is not full, but if it was full, I'm going to turn the cap on and it will come up to full. And I'm going to turn the dial to ensure that there is a good flow rate. I'm going to close the cap and let the air bleed out and then turn it back to 0. This is my high concentration mask. I'm going to make sure that the tubing is okay and then there is no kinks in here. I'm going to connect it to the oxygen tank and turn it on to 10 litres per minute. And then I'm going to put it over the nose and mouth of the patient and pinch it on the nose and ensure a good seal either by me or the patient themselves. I'm going to ensure that the reservoir mask stays inflated. Oxygen is indicated for SATs below 94%, airway obstruction, shock, respiratory distress, TBI or carbon monoxide poisoning. And this mask has a high flow oxygen rate of 90% or over. To take off, I'm going to take it off like so, make sure that this stays on. And now to turn it off, I'm going to turn the cap, let the air bleed out and turn it to 0. And then twist this off and pull my regulator up. This is our first response kit, and here we have our hemorrhage control pocket, which contains correct bandages, 2 different sizes of transport tape, tourniquets, triangular bandages, steri strips, combined dressing, sterile gauze pads, and also saline ampules. Now in here we have our diagnostic pocket, which contains a pediatric and also adult blood pressure cuff, clothing shears, stethoscope, blood glucose meter, thermometer and covers, and also a pupil torch. And here we have our mesis bags, ethyl chloride spray, N95 mask, and also cervical spinal lanyard. Now in here we have our 500ml glucose, our glucose sachets, our glucagon, and our giving set. Also this is our miscellaneous pocket, and here we have a bluey. Inside we have our towel, our sharps container, our cardboard splints, our transfer belt, our collar. We have our saline, and we also have a giving set. We have a slippery Sam, we have a pediatric and adult BVM, we have a LMA. In here we have our nebulizers, we have our nebulizer mask, bowl and oxygen tubing. We have our adrenaline, salbutamol, ipratropium. And here we have our OPAs, MPAs, all of different sizes, our biohazard bag, a lube. We have forceps, we also have the laryngoscopes. In here we have our methoxyflurane, our paracetamol, ibuprofen, our tramadol, loratadine, and also ondansetron. To test my suction unit, I'm going to check that the tubing is not kinked and it is intact and in good condition. I'm going to turn it on to full and kink my tube. You can also see that the battery is full and that I'm wearing my correct PPE, my glasses and my gloves. Now you can see that the maximum pressure has been reached, so I'm going to unkink my tube. You want to ensure that your patient is in a lateral position so gravity works in our favour. For the purpose of this video, my mannequin is going to be lying on his back and with his head tilted. To suction, you want to insert the catheter to only as far as you can see without covering the hole. This is to not cause damage. Now to suction, I want to place my finger over the hole and suction on the way out in circular motions. I only want to do this for a maximum of 10 seconds in case they need breathing interventions and to minimise damage. I never want to use this in a moving vehicle. Complications with suctioning can include a patient with trismus and you cannot access through their mouth. You can also use a softer catheter to suction through an MPA and can also use this on paediatrics. If larger foreign matter can be seen in obstructing an airway, finger sweeping is best advised as opposed to using the suction catheter as the head is too small. Here we have our HeartStar MRX that we use on the ambulance. It is an ECG and defib monitor. Firstly, when we get on shift, we want to check that it is all working. So what we're going to do is put it on adult dose 150 joules. We'll plug in our test resistor and we'll go to menu, and we'll go down to other, and from here we'll go operational checks, run op check, and then it's just going to say, are we acknowledging that it's leaving monitor mode? So we go yes. So while that's starting up, I'm going to run through what's in this pocket. So in here we find our defib pads that we use for shocking, and we also have drugs, our aspirin and GTN, that we need to make sure are within the date and not expired. We also have a razor to shave hairy men or ladies. So now this is asking me to charge, so I'm just going to push this charge button, and now it's going to go shock.
Shock delivered.
And it's asking me whether I heard that, and yes, I heard that. So now it's just going to continue on through. In our back pocket we find spare ECG paper, which is found in here. I'm just quickly going to quickly check that. Yep, so we have enough for the shift. Also we find spare ECG, sticky dots, batteries. The batteries we find in the back of the MRX. So there's little buttons on the top that we just want to push to check how full they are. But also if you check up here, this can also show you what level they are at. In the back we also find different sizes of blood pressure cuffs. On this side we find the diagnostic area. So this is our end-tidal CO2, which just plugs into up here. And what this measures is our CO2 on exhalation. Here we find our SpO2 reader. So we just want to put our finger inside and make sure our fingers are clean, free of nail polish, dry, and that will measure our percentage of oxygen in our blood. Here we have our non-invasive blood pressure cuff, which measures your blood pressure, systolic, diastolic, and works exactly the same as a manual one we would find in our first response kit. And here we have our ECG leads, our 12 leads. But in this case we're going to use our 3 lead, which has 4 terminals, and we just want to ensure that it is all good, no tangles and all of that. And here we also have our CPR puck, which is very good because it measures how well we're doing in our chest compressions. So this is just printing, and it's just printing out just telling us that we've passed our check. So we'll just let that print. So now that's finished, we're just going to pop this away, and we can see that we've passed, but it's just telling us that we need to change the B battery. So now what we can do is we can go exit op check, and we'll turn it back on to monitor. But first we want to take our test resistor off and plug back in our defib pads, just in case we are called out to a resus. Also with the blood pressure, to measure your blood pressure, you pop it on the patient and you push start NBP. And also this is where you can read your SpO2 reading. So now I'm just going to show you how we attach our 3 leads and what waves we're kind of looking at. So what we want to do is we want to go right leg on the right side of the patient, not our right, their right, left leg. We also want to make sure that it doesn't go on any bony areas, and that we're not covering any hair, and the patient has to be clean and dry so we get a good reading. This goes on our right arm, see, we don't want it on our collarbone. And now it's starting to read my heart rhythm. So I'm just going to turn off the audio. So now you can see here that it's starting to read my heart rhythm, and you can change views. So you push this button up here and it goes through different views. And so now we're on view 1. And so we can also change the volume. So what we want to do is go menu, volume, QRS, and we can make it loud, very loud. So with the very loud, you can correlate it with your own pulse to see if the machine is working properly. You can also go soft, very soft, or just turn it off completely. You can also change the size of the waves that are displayed. So you go, well, I'll go back through that. Menu, displayed waves, wave 1, choose the wave that you're on, and you can go up to ×4 or times a quarter, but we would like to just keep it on ×1 because that's the default setting. So now we can also go into manual defib if you need to manually shock somebody. We're going to put our test resistor back in, and what we want to do is go charge. So we're on adult dose 150 joules. Now it's saying it's charged and we can shock. So now it's given the shock. But if you're charging and you want to disarm your shock, you just push disarm down here, and now it's disarmed. And now it's just printing what's going on. We can stop printing by pushing this button here. And also, if you're at a job and the patient suddenly goes into cardiac arrest and you quickly need to go to AED mode, you can quickly turn the knob in here on AED and you just follow the prompts. And yeah, that's pretty much our Heart Start MRX. Before starting our shift, we need to ensure that the bag valve mask is all in good condition. So what we do is we'll pull it out, we'll pump it up, we'll take the bag off, we'll hold it on here, inflate it, make sure there's no holes and make sure that it stays inflated, put it back on the bottom, get our oxygen tubing out and just stick that on the bottom like so. In this video I'm going to demonstrate how to insert and measure an MPA. So first you want to measure from the nostril to the earlobe, that's the correct size. You want to lube it and then you want to insert in the largest nostril straight up and down. We've been called to a 65-year-old male who has collapsed after having chest pain for 5 minutes. Livy, if this is a resus, would you be happy to do chest compressions and maybe get the bag out while I check the airways? Yep. So we're wearing our correct PPE, our glasses and our gloves. Also we're aware of any dangers, but there appears to be none. Hello sir, can you hear me? We're from the ambulance. I'm Ellen, this is Livy. Hello sir. Sir, can you hear me? Open your eyes, open your eyes. I'm just going to check for the airway. The airway seems to be clear, but GCS of 3, so no signs of consciousness. Just checking the breathing, look, listen and feeling for 10 seconds. No obvious signs of breathing. Livy, can I please get you to start chest compressions? AU2 to comms. Could we have an R50 on an R49 over? Alright Livy, you just continue on that and I'll work around you. Ooh. So I'm just going to stick a towel underneath it and put him in the sniffing position. Okay, don't touch the patient for a second.
Touch the patient.
Oh, thank you.
Shock advised.
Okay, Livy, can you jump back on there, please? So I've just got an OPA out. Okay, don't touch the patient. Oh no, carry on. Sorry. Yep, okay, don't touch the patient. Alright, shocking. Shock the patient. Back on, please. So I've just got an OPA out. So this is another airway to use. So I'm just going to measure from the corner of the mouth to the mandible. This is the correct size. So what I'm going to do is I'm going to insert from upside down and turn 180 and stick it in. So an OPA is indicated when the patient has a GCS lower than 8 and also when manual airway intervention is needed. But a contraindication is when a patient has trismus or you have no access to the mouth. So therefore you would use an MPA. To use an MPA you want to insert through the largest nostril and insert straight down, pushing all the way in. And this can be used with a higher GCS. But it cannot be used if there is suspectable brain injury or skull fractures. Sorry, just skull fractures. So now I'm just going to hook up my oxygen and I want it on 15, but a bag valve mask can be used at 10 to 15. So to use this, I want to use a C-grip, put it over the nose and the mouth. It might be quite hard sometimes because a patient may have facial hair, facial trauma, and elderly or obesity patients make it quite hard to use this mask. Can you just stop there and I want to check the airway? Okay, cool. Yep, I'm getting good airway. Okay, so now I'm using a C-grip and I want Livy to start counting 30 and I'm going to do two breathing. So I want a ratio of 30 to 2. Livy, also when this analyzes again, can I get you to come to the left and I'll go to the left and I'll start my chest compressions?
Yeah, 30.
Okay, so I'm not getting a very good seal, so I'm going to use a double-handed grip. And I want Livy to squeeze the bag 2 times, just making sure that she doesn't squeeze it too hard because you don't want the lungs to expand too much because it's just not normal for a patient or for anybody to just take in too much breathing.
30.
Okay, can you do that for me please? Cool, thank you. And you also want to make sure that the patient is in a head tilting position. Okay, stop there. Okay, we'll swap over.
Analyzing heart rhythm. Stay clear of patient.
Alright.
Analyzing heart rhythm, no shock advised.
Okay, so I'm
Pause.
jumping back onto chest compressions.
If needed, start CPR.
Also, when I was in the position of, Libby, can I get you to start counting for me, please? Also, I can be asking what's going on to ballot bystanders, what has happened. Like medical history, drugs, medication, whatever has been happening. Also, I want to make sure that I'm going 1/3 of the depth of the chest and that I am doing a good recoil. And I also want to be going at a 110 beats per minute rate.
I'm not getting a good feel. Can you do the bar mask next time?
Yep.
19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6.
So I'm using a bag valve mask because it's good for it has a high oxygen concentration, so it delivers 100%. Also, to get your hands in a good position when you do CPR, you just want to go from under the armpit and into the middle of the chest. Also, sometimes AEDs have a option that you can use a metronome, so therefore you keep your beats up at a good rate.
Stop CPR.